So we'll go ahead and get started. Hi, everybody. Just a quick welcome, couple of disclaimers. This video presentation will be recorded, so if you do not want to be recorded, please make sure to mute yourselves and to hide your video. So without further ado, I'm going to introduce Miss Lily. She is one of our, she's the AARP representative for the Commission on Aging for the City of Grand Prairie. And she is here to tell us about a little bit about telemedicine and telehealth. So without further ado, Miss Lily.
Good afternoon, everybody. And today I'm going to cover the telemedicine, and then I'm going to talk a little bit about the history of telemedicine, and then the AARP how-to guide to use telemedicine. So they'll make you comfortable in using telemedicine. So there's a little quiz, and then we're going to talk a little bit about advantages, and then we're going to talk about concerns and considerations. And there will be a section later on for questions and discussions. And then, so if you have any things you want to share with us, be sure you put in the chat, and also put your answers to the quiz in the chat. Okay, history of telemedicine. So traditionally, patients with chronic disease are seen in the doctor's office for physiologic measurements. And now, more than a decade ago, VA developed a care management program that offered personalized education, monitoring, and feedback at home from a remote disease management support team. Studies of home monitoring have shown specific improvement, especially in the management of hypertension, congestive heart failure, and diabetes. Alaska has been a model for the development and the use of telemedicine for decades. And in Alaska, the community health aides, they would do the otoscopy. It means they'll look into the ear when people complain about ear problem, or they would do the eye exam. So all these results are then forwarded to the centers in Anchorage in Alaska, and they will determine whether the patient needs to travel to the hospital for further treatment. Because, you know, Alaska is so huge and it has a lot of rural areas. But so far, dermatology and psychology, they are the two of the biggest areas of telemedicine. Okay, my first question is, how long has telemedicine been around? 10 years, 20 years, 40 years? So make a wild guess, you know. And put your answer in the chat, you know, or we can discuss about that at the end of the topic. So the next question, what are the types of telemedicine? Store, remote monitoring, real-time interactive services, all of the above. Okay, I hope I've given you enough time. And now we're going to proceed. AARP, the future of healthcare is here. And this is from the AARP bulletin board. So I'll give the answers right now. Okay, the answer, the first one, How many of you guessed 40 years? If you do, you got it right. And the answer, the second question was all the above. So telemedicine is like you had remote monitoring from a rural area, and then also you have interaction with your doctor. So all of the above is the correct answer. I hope y'all got it right. So now back to the future of healthcare is here. This is from the AARP Bulletin Board, June 2020. I'm surprised when I first do my research to say the number of telemedicine consultations will reach 160 million cases by 2020, a 700% increase since 2015. So with the onset of COVID, probably the numbers are a little bit higher. So I really don't know until the next research. This is something kind of strange to say. 77% of consumers say they will be more likely to choose a doctor who offers telemedicine. However, just 18% of consumers have used this type of service. And I hope after this how-to guide, more people will feel comfortable using telemedicine. Here we go. The COVID-19 pandemic has turned telehealth from a maybe one day to right here, right now, and it's been happening. So here's the how-to guide about telemedicine. There's several things to consider before you can really do telemedicine. So I'm going to go to the 6 steps one by one. So the first one is consider your condition. Usually telemedicine is kind of mild cases like say COVID-19 is here, you had a fever, you have 100, and you got a little cough, and you don't know what to do. So that's where telemedicine comes in. You did a consultation, and they'll tell you what to do. Or you just have diarrhea, or you have headache, or you have some cough, or you have ear problem, and then you have flu symptoms. And then a lot of people right now, because the pollen count is high, some allergy problems. So urinary tract infection is a very common one because folks, we always forget to hydrate ourselves. We need to hydrate ourselves in the summertime so you have a good flow, and they'll prevent you from getting UTI. The next one is check your insurance. You know, insurance, the main part is very costly. So you want to make sure your insurance covers telemedicine. There are some restrictions, but since the COVID-19, Medicare has okay for us to use the telemedicine, and they'll cover the expenses. Pick a provider, and my provider at Methodist Healthcare, they covers telehealth. So you got to make sure that you pick somebody that you already used before, or there's so many options in that. Like when you pick a provider also, some of them had pharmacies and they have labs attached to them, and they will save you a lot of traveling. And also, let's say, for example, you're not sure about the doctor, this doctor is kind of new to you, you can Google search. And then in Google search, you can read the reviews of that. And then people always give honest review, you know, and then you yourself can figure, oh, is this review really a small thing or a big thing? And then you can proceed from there. And also, I found that friends and family are really help because, like I said, Okay, Nancy, what about the doctor, your foot doctor? Did you like it? I think I might need a foot doctor. So reference from friends and family do help us a lot in picking a provider, and also the distance. You don't want to drive from Grand Prairie to Dallas. You want to help the local business, the local doctor, and find somebody in Grand Prairie. Prepare for your visit. Now, how do you prepare for your visit? Here are the things that you need to prepare for your visit, okay? You need to have a computer, a tablet, a smartphone with a good camera in case you want to take pictures of it. And then also, you need a good internet connection. And also, you need to be in a quiet room because when the doctor is talking to you, you want to hear what he's asking you about. So the list of questions to me is very important. It's just like your regular visit on site. You always make sure you have a list of questions before you go see the doctor, because if you don't, when you hit the doctor's office, you forgot what you're going to ask him about. So the list is very important. Excuse me. And also, you need to have prescription bottles, because if you're talking about hypertension medicine, the doctor wants to know how many milligrams of the tablet you're taking and how often, and then you can just show the bottle so he'll know what you're talking about. And also, sometimes they need you to take a thermometer to check your temperature, or you need to have your blood pressure monitor around in case you say, okay, Miss Lee, take your blood pressure right now. Of course, it's going to be high because I'm so worried, right? But always take a few breaths before you take blood pressure. And also, you might need a flashlight if the doctor wants you to look into your throat and all that. So those are the things that you might need. Next, number 5, see the doctor. So to see the doctor, the provider will always, when you call to make an appointment, the provider will give you a link. And then when the day of your appointment, you just go on the link like you did just now to get on Zoom here. It could be either FaceTime, Skype, or Zoom. And then also, you need some preliminaries, because they usually ask you some screening questions like, okay, when did your cough started? Okay, were you in contact with a person who has COVID-19 in the last 3 days? Those are some of the screening questions, but different providers have different screening questions. And then to get started, the preliminaries is you answer these questions and then be ready to answer. The next one is follow the instructions. After your interaction with the doctor, he'll give you a diagnosis. And then if you need a prescription, he will forward the prescription to your pharmacy. You know, whichever pharmacy your healthcare provides you, CVS or Walgreens and all that. And also, if he needs to do a lab work, you might need to go to a lab. But some facilities, they have a drive-through. So you drive your car up to the station, they check your ID, you stick out your arm, they draw your blood, so you don't even have to enter the building. So different facilities provide different things in there. Okay, so the how-to guide, these are how-to guide. Hopefully they're very helpful to you. So what are the advantages of telemedicine? So in short, this Agency for Health Research and Quality in 2019, in the review, this is what they found. So it's like telehealth consultation produced better outcomes or no differences at all. Remote ICU consultations likely reduce mortality because you get the immediate response instead of traveling time. EMS And the urgent care telehealth program, they had reduced death from heart attacks. They led to more timely care, and they reduced the need for air transfers. And this helps a lot because, like, if you had a heart attack and you don't get immediate care, and then you might die from that. So this telehealth medicine helps that. In the outpatient services, evidence of improved outcomes with telehealth was strongest in 3 areas. And guess what they are? Ready? Better healing and wound care. They taught you like how to clean your wound and all that. And just like from you clean your own wound, that prevents the wound getting an infection. And also it speeds up the healing because you want to do it correctly, because you want to make sure the wound is getting smaller and smaller, so you'll be able to put your socks on and go back to dancing and walking and all that. So that is better healing and wound care, especially for diabetic patients when they had a wound, and that process of healing takes a longer time because of the sugar level. Then they had a higher response in psychiatry, like patients that have problems and they're so embarrassed that they don't want to have on-site visit and all that. So with telemedicine, they feel more comfortable at home talking to their healthcare provider. And then also they feel it's more private. They can answer the questions, more like telling the truth and not trying to hide it away. Improvement in chronic conditions such as diabetes and congestive heart failure. So these are chronic conditions that affect a lot of people: diabetes, congestive heart failure, and also, diabetes. You can do a lot personally. If it's type 2 diabetes, you can prevent it. And then by making dietary changes, your lifestyle changes. But if it's type 1, it runs in the family, and then you might have to do is get insulin and all that. But nowadays you can monitor by wearing a monitor. They'll tell you what your blood sugar is, when you need the insulin and all that. So these are the advantages of telemedicine: better healing and wound care, and higher response in psychiatry, and also improvement in chronic conditions like diabetes and heart failure. So next thing I'm going to talk about is concerns and caution. So, okay, so what are the concerns? The the Agency of Health Research Quality found that telestroke services, telestroke did not produce benefits in either in-hospital or 3-month mortality rate. And here we are, concerns and caution. Like I said, the HRQ found that telestroke services did not produce a benefit in either the in-hospital or the 3-month mortality rate. And also, mis or incorrect diagnosis are also a concern. Like the mis and incorrect diagnosis can also happen when you had an on-site visit, because if the doctor didn't read your x-ray correctly, he might miss the dot that's in your lung x-ray. So these can also happen in the on-site visit. And in the stimulated patient encounters, the practitioners fail to take an adequate history, make incorrect diagnosis, and miss issues such as syphilis and skin care. What isn't clear whether the correct diagnosis would have made in person also, like I said previously. And this is from Dr. Tun. He's the lead investigator for the AHQL study guide. And so the same thing, potential harms in telehealth versus an in-site visit. It can happen either way. So is telehealth the new normal? Let's see. The Department of Human and Health Services, they changed the security standard to allow the use of technologies such as FaceTime, Skype, and Zoom. Digital divide as an obstacle because there's like about 21 million Americans, they lack broadband internet, especially in the rural areas. And then Texas is so big, there's a lot of rural areas and also among the poor. So broadband internet is one of the things. And many patients lack a smartphone required for visual visits. Health insurance coverage of telemedicine. But now, because of COVID-19, many health insurance, they are providing that for this period of pandemic. So in 2018, the survey doctors were reluctant to offer telemedicine services because at that time, the insurance didn't cover the visual visit, or they were reimbursed in a much lower rates. So that's one reason too. So under the emergency rule, Medicare is compensating doctors for visual visits at the same rate as in-person visits. So this helps a lot. Many private insurers have followed suit, but policies vary. Policies put in place during the pandemic are designed as temporary for right now. So let's continue. 84% of US patients said they would be more likely to select a provider who offers telemedicine over one that doesn't. This is according to the Atrium Health. Rose say that the last thing anyone with a chronic health problem needs to do is get in the car, drive, and wait in the waiting room. Now we had some quick questions for round 2. Are you all ready? Telemedicine is a new dance during the pandemic, a visit between a patient and a healthcare provider by telephone, smartphone, tablet, or computer, an online pharmacy. So be sure you put your answer in the chat. What are the advantages of telemedicine? It takes minutes to complete the visit. Disabled and cancer patients prefer telemedicine. All of the above. A recent survey of US patients on using telemedicine results in will not use telemedicine. 60% will use telemedicine. 84% use telemedicine. And I'm ready to give you the answer. You're ready for the answer? Okay, so telemedicine is B, a visit between a patient and healthcare providers either by telephone, smartphone, tablet, or computer. Congratulations, you get it right. What are the advantages of telemedicine? All of the above, especially, for people that had mobility issues and all that. It helps them a lot just, to talk to the doctor over the phone instead of getting in the car and all. So a recent survey of US patients on using telemedicine results in. So how many of you pick C? C is the right answer. 84% will use telemedicine. Thank you, y'all. Your questions and discussions.
Thank you, Lily.
And
We
hold
we
on,
appreciate it.
I still have some more that I want to talk about. I still have time, don't I?
Okay.
Yeah. Okay. On this one, the survey shows that survey results shows the advantages of telemedicine because it eliminates the waiting for visit. And also, when you're old, you get really nervous trying to find a parking spot. You drive around and round and round, you can't find a parking spot, or the handicap parking is already filled and you have problem walking. So that helps. And also it's less stress. You don't have to remember where you park after the visit, and then you'll be looking in the hot sun. Where did I park my car? Where did I park my car? And also, you do not have to leave home. Whenever you're at home, you feel a lot more comfortable talking to your doctor. Your blood pressure doesn't go up, and then you don't feel nervous because you're at home. So you can tell the doctor whatever that's bothering you. So my discussion is, has anybody had a telemedicine visit before? So if you are concerned about security when you're making a visit, be sure to ask your provider. So what are your security measures? And they will tell you, because when they give you a link and a password and all that, nobody's going to get that except you. So you're pretty secured in that way. And also, I want to go over prepare for your visit. You want to make sure those things are ready. So like your visit is 10 o'clock, you make sure you have a thermometer, your blood pressure set, your medicine bottles, and your list of questions all beside you, so you don't have to get up and go searching for them. And also on people that had congestive heart failure, most of the time the doctor gives them an O2 saturation monitor to take home. And then the doctor might ask, like, Ms. Smith, what is your saturation now? So if you had your saturation beside you, you just clip it to your finger and you can tell them the reading right away. And also, so the list of questions that I said is very important. So now, open to questions. Does anybody have any questions? Give you an example, like say Mr. Jones, he was given a new antihypertensive medication, and after he took 1 or 2 doses, he felt that he was coughing a lot. And on his previous antihypertensive medicine, he never coughed at all. So with telemedicine, he just called the office and tell them, he's been coughing and that keep him awake and all that. And he couldn't sleep through the night. And then he checked his blood pressure. Instead of going down, his blood pressure is going up. So in that way, that helps him, that he can read out the blood pressure readings that he had taken every morning to the doctor. And so the doctor, after reviewing all this thing, that he told the patient, Jones, to stop taking the medication. And then he sent another one, which will make the coughing stop, because that medicine he prescribed him was making him coughing a lot. And that's one of the side effects of the medicine. And also, if you have hypertension, the DASH diet, DASH, DASH is the dietary, A is the approach, and then S is to stop, and then H is hypertension. So what is in the DASH diet? The DASH diet mainly consists of a lot of fruits and vegetables, high grain. So if you want to lower your blood pressure, of course you start a regular exercise like walking, take a deep breath. Anything that stresses you, you take deep breaths to kind of go make sure your blood pressure go away, and you drink a lot of water. And a lot of people don't realize that when they don't sit, they don't have 7 to 8 hours of sleep, and that would cause a lot of problem too. So be sure you don't take long naps in the afternoon, and then you will sleep well at night, and that helps your health a lot. And also, like in Grand Prairie, we have a lot of urgent care around us, you know, and most of them, they do take telemedicine, and you'll, you tell them what your provider is before you visit, and they will tell you right away whether that your provider will cover the telemedicine. And okay, so you know, you are considered you're hypertensive if your blood pressure is greater than, depends on your age. If you're 80 years old, your blood pressure is 150 over 90, your doctor would just kind of tell you, like, okay, let's kind of watch your lifestyle, go on a DASH diet before I start you on a medication. So there's many ways of approaching hypertension without getting the prescription. And then say, so you need to check your blood pressure. Like, the best time to check your blood pressure is when you wake up in the morning, because once you're up in the day, you have many things going on. Or sometimes when you watch the news about the COVID-19 and all that, and then you see all these people suffering, they'll make your blood pressure go up. So one suggestion, if the news bothers you, don't watch the news that often. Put on some noise, good classical music. You calm down, and you think of positive things, so blood pressure won't go up. And I think that's about all that I have.
Thanks so much, Lily. We really appreciate you coming on.
Anytime, and I hope you all benefit, and I hope that with a how-to guide to telemedicine will not intimidate you. And you say, okay, COVID-19, I cannot go to the doctor, but I want to be checked out. So you can call your doctor and then proceed from there. So thank you,
Yes,
y'all,
ma'am.
for attending. Y'all have a nice day.
Thank you, Lily. Very good information. This will
Thank
be
you.
posted on our Facebook and hopefully our Grand Fund GP website soon. So stay tuned for that. We really appreciate it. And
You're welcome.
Lily, we hope to see you soon.
Okay, thank you. Bye-bye.
Bye-bye.